want to then focus down. We're going to drill down on hemophilia for a while. I don't mean to exclude you. And in fact, as someone who handles a disease which you tell me is not as rare as it may otherwise have been thought to be, yet is it rare. So please join us as we drill down on hemophilia for a while. Patrick, why don't you start off with the pathophysiologic basis of hemophilia A and B, because my medical school's a little rusty.
Sure. Well, hemophilia is a congenital deficiency of either clotting factor 8, which leads to hemophilia A, or clotting factor 9, which leads to hemophilia B. Those proteins are essential in the ability of the body to form a blood clot at the site of a vascular injury. So if you lack those proteins, or if they are present in subnormal concentrations, then bleeding occurs.
And it's males only.
Yes, hemophilia is an X-linked recessive disorder, so typically, males are affected and females are carriers.
And there's a genetic predisposition, clearly because of its genetic issue.
Interestingly, about 40% of cases of hemophilia A, it is thought, actually occur as a result of a spontaneous mutation, either in the patient or in the patient's mother.
And the last, is there a variable penetrance to this? Do some people have hemophilia worse than others, or is it just binary? You've got it or you don't?
Well, I guess it is sort of yes and no, but really where it shakes out is in the degrees of severity. If there's a familial lineage of severe hemophilia in males, then if a child is born into that lineage, it will be the same genetic defect and the same phenotype. It will be severe hemophilia. It can't express as like mild hemophilia, for instance. So the genetic predisposition breeds true in that patient's family.
It's a terrible disease.
Severe hemophilia is characterized by the onset of spontaneous bleeding, typically into first soft tissues, but then as a baby begins to really move around and walk, then into joints from a very early age. And blood destroys a joint, and there are a variety of biochemical pathways that have been described. We're still learning more about why that happens, but the end result, if an individual doesn't die of a serious bleeding event, such as gastrointestinal or intracranial, is a chronic disabling hemophilic arthropathy that leads to tremendous arthritis in knees, ankles, elbows, and it's a debilitating condition.
And so the syntax is hemarthrosis
yes.
leads to hemarthritis, leads to joint destruction.
Well, the destruction's happening, I think, from the get-go, and certainly the expression is a terrible arthritis that's called hemophilic arthropathy.
It's just awful. It's almost redundant, but I'm going to ask the question anyway. What is the impact then, from the get-go, on the patient's quality of life?
Well, we know if a person has experienced repeated bleeding episodes as a child and then adolescent, then it's not uncommon for those types of patients to require knee replacement, for instance, at age 22. But these are kids who can't really participate in school as they should, because they're home with painful bleeding events. The standard of care in the U.S. has been, again, to administer preventative doses of clotting factor concentrate to really, as a replacement therapy, change the phenotype of that individual completely to that of a person with, adequate coagulation for the most part.
What do you see from your perspective?
Well, as Patrick mentioned, definitely it impacts the patient's quality of life in terms of patients missing days from work, missing days from school, not being able to participate in sports, and just the feeling of you have to be careful with everything you do. It's like you're living in a bubble. Every time you want to go out to ride a bike with your friends, your parents have to make sure that you have preventive gear on and making sure that you don't get hurt very easily. And so I'm sure for the kid also, it makes you feel different from your peers, because here your friends just being able to go outside, play baseball, play soccer, and here you are as a kid that has hemophilia. You're always being pampered or being protected, but again, for your own good.
And that's quality of life. Let's talk about dollars. I keep turning this way for dollars and cents. I don't know why. The economic burden on patients, payers, and society as a role of this disease. It's complicated, isn't it?
It's complicated, it's significant. Of course, we haven't talked about inhibitors, but that's obviously a consequence of therapy as well. So the treatment helps to keep you normal. If you want to play contact sports, you're going to have to take factor.
But can I stop you? Can hemophiliacs play contact sports? I mean, would you take a hemophiliac, suit him up, and put him on a hockey rink?
The thing to remember that, this is a disease that's characterized by the deficiency of a singular protein that, if infused and replaced, at least as long as it's hanging around in the circulation, makes that individual just like anybody else. So it's possible how to dissect, target levels for factor VIII or factor IX that are appropriate for kids who want to play different types of sports really is a matter of ongoing debate. But yes, they could.
That's ridiculously interesting. I mean, because
Well,
a generation ago we didn't have that.
Well, it's freeing, I think, what it is.
It's
really,
great.
and it's expensive.
He comes back to you.
Yes.
Why did he just sort of laser in on, but it's expensive.
Yes.
It's a problem, I think, that an issue that we all have to sort of think about and work on.